A thorough physical examination is an important part of understanding which patients are good candidates for eye-tight therapy. Patients with poor lid tone are not good candidates for this technique. In order to document lid tone, a snap test and a pinch test should be performed on every patient prior to therapy. In addition, it's important to document the presence of fat pads and the location of the fat pads. While the fat pads are traditionally in 3 compartments, it's always worthwhile to outline those compartments as part of your preoperative marking. The physical examination for these patients is performed in the sitting position in order to document the snap test, the pinch test, and the location of the fat pads. The snap test is performed by distracting the lid away from the globe and observing its return to its normal anatomical position. It should be performed on both sides and indeed demonstrates good lower eyelid tone. A confirmatory test of lower eyelid tones is the pinch test, in which the lid is distracted anteriorly away from the globe, and again the lid snaps back to the globe. This patient has good lid tone and is a good candidate for eye-tight therapy. To identify the fat pads, it's ideal to have the patient gaze upward at the ceiling. Hold your gaze there and you can outline the entire fat pad on each lower eyelid. The next step is to outline each compartment, central, medial, and lateral compartments. Once the patient is supine, the landmarks are gone and the only reference point the surgeon has is the marking. To document the presence of the fat pads, have the patient gaze upward to the ceiling. Dots can be used to outline the inferior border of all of the fat pads. By having the patient gaze upward and to the right, you can outline the lateral fat pad on the left eye and the medial fat pad on the right eye. Having the patient gaze in the opposite direction, upward and to the left, outlines the lateral fat pad on the right eye and the medial fat pad on the left eye. The space in between is the central fat pad. Laser energy must be applied to each of these fat pads in order to vaporize fat sufficiently and create the desired result. The head is lowered and the patient is now 30 degrees from the horizontal. This enables the surgeon to safely perform the procedure and minimizes bleeding and bruising. Local anesthesia is applied to the lower eyelid. The anesthetic is 1% xylocaine with epinephrine 1 to 100,000. Typically 2 to 3 cc's is needed for each lower eyelid. A 30-gauge needle makes the procedure more comfortable for the patient as the initial injection. Once that's placed, you can change to a 25-gauge needle, which enables the surgeon to reach from the lateral to the medial fat pads. Again, by entering the already anesthetized area, the procedure is more comfortable for the patient. Gentle massage can be used to disperse the anesthetic. In addition, it's important to wait at least 7 minutes to maximize the epinephrine effect of the xylocaine with epinephrine. The surgeon can monitor the blanching of the skin that occurs as an indicator of the success of the block. The lower eyelids are prepped with betadine. Be sure to go lateral to the lateral canthal region because the entry point goes in the crow's foot. It's often helpful to go back and assure that there's sufficient anesthesia in the region of the lateral canthus. An additional 1 cc is helpful to maintain a good block. fiber is removed from its container. Fiber is placed into the laser aperture and secured by screwing it in. Once the fiber is snugly attached, the magnet with its chip is placed in the port on top of the laser, and the laser is turned on.
Fiber connected, loading chip. Press select to continue.
So we're going to do our fiber test. Press the ready button. Make sure we have goggles on. The fiber test is performed by placing the fiber in the tube to the bottom of the tube. The laser's fired. Fiber demonstrates an 85% power range, which is well within the range that's desired.